Alright. Alright. We are going to do a wet to dry dressing change. The first thing we're going to do is check the doctor's orders to make sure that it is time to do the dressing change. We'll identify the patient with 2 identifiers, identify ourselves to the patient, and gather our equipment at the bedside table. We'll assess the patient's pain level on a scale from 0 to 10, and we will position the patient and provide privacy for him as well. And we will also expose the wound area, making sure as not to cover or uncover areas that are not needed to be shown. Go ahead and perform hand hygiene, and we'll go up and set up our sterile field. I'll take out the first set of sterile gloves. Discard this wrapper. And we'll take all our rest of our equipment and put it on the sterile drape. Place the biohazard bag in a nearby area, and we'll remove the old dressing. Removing the chape, making sure as not to harm the skin surrounding the wound area. Alright. Now we'll take our measuring ruler, measure the length, width, and in a given scenario we would also check the depth of the wound by using a Q-tip applicator and measuring it from the deepest part. And we'll dispose of that. We'll remove the first set of sterile gloves, perform hand hygiene, and we'll go ahead and put our next set of sterile gloves on. We'll pour our normal saline into the sterile bin. Add our fluffed out gauze. Alright, take some and gently pack the wound, making sure it's not so tight, but making sure that the whole wound area is covered. And we'll cover that with our dry 4x4s. And baby pad. go ahead and tape the sides of bandage.
We just took the liberty to put your date and initial and time before you put it on the patient. And that's fine.
And this tape just so happens to have my name, date, and time on it already. And there you go. We'll go ahead and remove the gloves. We can toss the rest of the equipment, cover up the patient again, lower the bed down to its safest, lowest level, make sure the patient doesn't need anything before we leave, and then we'll go back to our workstation and document the procedure that we just did. That's it.